Finished? Thank you. Member from Sarnia-Lambton.
Thank you, Mr. Speaker. Speaker, to you and through you to the acting premier. Last Friday, I received a call from Lonnie Cope, a constituent of mine in Petrolia, a first responder with more than 2 decades of experience responding whenever and wherever he was needed. Lonnie told me that the workplace traumatic stress program at London Health Science Centre, which he has been utilizing to deal with symptoms of PTSD, is being cancelled, effective December 2nd. London Health Science Centre says there is no support from your government to keep this program running. Lonnie is being told that the next closest place that he can access these same services now offered by the Workplace Traumatic Stress Program is in Toronto, hundreds of kilometres away from our community. The acting premier, Speaker, the Workplace Traumatic Stress Program at London Health Science Centre closes for good in 8 weeks. Will your government commit today to stepping up and support this program before December 2nd deadline?
Speaker to the Minister of Labour.
Minister of Labour.
Thank you, Speaker, and thank you to the question. Certainly, I think the interest that the province has now in post-traumatic stress disorder, the impact that it's had on first responders in this province is one that has really accelerated over the years. WSIB now has a program in place. Those people that are first responders in our province, Speaker, now have presumptive legislation. The ease of obtaining that treatment, Speaker, has been accelerated over the years. One of the centres we have used, Speaker, at the WSIB is the London Health Sciences Centre. As we take a look at services that are made available to our first responders, we'd like to see them obviously provided on a province-wide basis, Speaker. I will take the question from the minister, talk to the WSIB again, Speaker, and see if these changes are indeed in the best interest of the province.
Thank you. Supplementary.
Speaker, and back to the acting premier. Earlier this week, the CTV News London, your station in your town, reported that the Workplace Traumatic Stress Program at London Health Science Centre was closing because of a $500,000 annual shortfall in program funding from your government. First responders and clients of the Workplace Traumatic Stress Program have called this news devastating. Mr. Speaker, it takes a special type of person to risk their own health and safety, to rush to the aid of others in an emergency. Every community in Ontario depends on these brave individuals in a time of crisis. Mr. Speaker, to the acting premier, will you commit today to fully funding the Workplace Stress Program at London Health Science Centre so the first responders in our province have access to treatments and services where they need them?
Thank you. Minister.
Thank you, Speaker, and thanks again to the member. I know that he's asking the question in a sincere manner because I think all members of this House understand that what we haven't done in the past, Speaker, when it comes to our first responders and treatment for PTSD is something we should do in the future, something we can get better at, Speaker. As we examine the services that are available to first responders around the province, obviously we try and make those services as localized as possible. The WSIB, Speaker, which is an independent agency, strives as hard as it can to make sure that people don't have to travel long distances to obtain those services. I appreciate the question from the member opposite. I think it's a sincere question, and as I said, I will interact with the WSIB, the Board of Directors, and the people there that are running that organization to make sure we're providing services in the way we should, Speaker. Thank you.
Thank you. New question, the member from Kitchener-Waterloo.
Thank you very much.